just something on the outside, and things kind of just had to swing around that. The technology, because this tray grasps the teeth, you know, snugly, it's a more efficient movement, and, you know, adults wouldn't, if I said to you, Patrick, you could get your teeth straightened, but you're going to have to go down and get wires on your mouth, you'd go,
hot dog.
Yeah, I know. But if I said if I could do that and no one would see it,
that would
you
be
know,
amazing.
it is amazing.
And I imagine you've got some really amazing stories throughout the years of people that have...
I do, and I'm actually a premier provider, which is a status that you are awarded after you've done a number of cases. So I'm actually tonight, as a matter of fact, going to a meeting where they've asked me to be there because I'm one of the few dentists in North Texas that instead of taking a goopy impression, I have a digital scanner. So it just goes right into the computer, and the trays are made from that computer image, so the accuracy is levels above the goopy impression.
I just know of the goopy impression.
So that's the cutting edge, yeah.
That's pretty unique. Are there any other toys that you have that are like that?
Lasers. It's Dallas Laser Dentistry because I was an early fan of lasers. I use them in a lot of aesthetic cosmetic cases where you not only look at the teeth, but you look at the gums. It makes a difference. Now that I've said that, you're going to look at everybody's gums.
Oh, I'd probably not, but you know, I do tend to notice people's teeth.
Yeah.
So yours are
well,
beautiful.
There's a symmetry to the gums and the teeth, and there's some golden proportions and some rules that.
How do lasers do that? I mean, I'm sitting there thinking,
well, they
you know,
used to use a
Star Trek or something. You know, they're going to melt them. No,
it is melting. They used to use a scalpel, okay, a blade, okay, but lasers melt, and because of that, there's no. This is, I hate to get into the blood and gore. There's no blood.
Oh, good.
There's no, yeah, it's just a way to very non-invasively, very easy, no discomfort, no aftercare problems, just very, it's like trimming your cuticles, but it makes the biggest difference in a smile if you've got symmetrical gums and symmetrical teeth. If you've ever seen anybody where one tooth looks really long and the other one looks really short, lift that gum.
Of those, so. Well, that's good.
Yeah.
But how does, okay, so
Invisalign.
Invisalign, and then you've got the laser.
Well, sometimes people ask me, like in a cosmetic case, can you fix this, doc? And well, if you really look closely, I can't fix that until I get your teeth where they should be. The reason it's broken is because something needs to change.
Right. There's more stress on there than you think there is.
Exactly. And so we have to make sure, you know, for the long-term lasting of the restoration, it's like home improvements. The foundation has to be good. So it's a way of making the foundation good and then making the improvements on top of it.
So as we're coming up on this next segment, I want to go into who's the ideal client. So folks, you really want to be here for that, because many of you may be in a position where this is just perfect. Yes, I need to straighten the gums or straighten the teeth or literally brighten the smile. I know we were talking about brightening up some things. I know that I could use a little brightening. So with that, now I'm completely conscious about it. But
we can fix it.
Dallas Laser Dentistry can fix that. And this is Business Spotlight. The Business Spotlight is really about helping literally companies in the area tell their story and then getting it out into the marketplace. So with that, we'll be right back after this. And welcome back to the Business Spotlight. I'm your host, Patrick Dewar. My guest today, Dr. Mary Swift. She's a cosmetic dentist at Dallas Laser Dentistry. And I'm so thankful for you being on the show. Thank you.
Thank you.
I want to get into who's your ideal client and really get